Hello, gorgeous people. My name is Mo Quigg. I am coming to you straight from Atlanta, Georgia, and it is some very trying times. Our governor, the world is talking about him. A lot of people are afraid, confused, they don't know what to do. So I am talking to you about what's really going on, and I have some healthcare professionals that are going to lead the way, okay? I always tell people, the only person I'm listening to is the person who will be saving my life when things go bad. And it is not Governor Kemp. I love Mayor Bottoms, but it is not her either. So let's just get right into it. If you hadn't heard, our governor has decided that it is safe enough to reopen some extremely non-essential businesses starting April 24th. That is Friday, extremely soon, when he literally just extended the Georgia public health emergency April 8th, continuing the lockdown until May 13th for people like the elders and the most vulnerable. So it is still very confusing as to how these nail salons and barbershops are safe enough for us now. If that's not enough, April 27th, we're going to have to deal with things like movie theaters and bowling alleys being open, these super social spots. So even though Governor Kemp has stated and restated that there is going to be an extreme measurement on the reopening, such as masks on the employees, staggered shifts on the employees, even you not being able to just go out at your leisure and not go out with too many people. When you open things like movie theaters, these stipulations that you put on this opening sounds crazy. So we have some healthcare professionals right here, right now to talk about what Governor Kemp has said. Because if you hadn't heard him say, he said he has already consulted with the healthcare professionals and they are on his side. Take a listen to this.
I mean, look, I spent all weekend working with Dr. Toomey, who's a great epidemiology, a great public health official, one of the best I think in the country. I did not make this decision without her support.
All right, so we've got to talk to you all. Here on the panel, we have some extremely smart and capable individuals. I'd like to introduce you to Heather. She is coming from Emory. She is also a travel nurse, so she has seen COVID cases throughout these states. Maryam Muhammad, she is in labor and delivery. She too is a travel nurse and has been to New York, which was one of the most extreme places, and none other than Dr. Waz, who does emergency right here in the city of Atlanta. So Dr. Waz, we're gonna start off with you. We're gonna kick off with the most pertinent question. Now, we have heard Governor Kemp say that he's consulted with healthcare professionals already. So in your professional opinion, is it safe for us to return?
Well, I'm not an epidemiologist. I'm just an old ER doctor who work on the front line and actually take care of these patients in the emergency department when they present. I will tell you, I work in the largest catchment area, being South Fulton area on Cleveland Avenue. It's an area that we have a huge population of diabetes, high blood pressure, comorbid condition, including asthma. So Governor Kemp opened up the system, I think, anecdotally will put those persons at risk to having bad outcomes from COVID-19. It's unfortunate. I feel like we needed more time to have better surveillance, better measures in place to take care of the sick once they become sick, as well as a better financial solution to support those who need to stay at home.
That's a great response. And it seems as though our mayor, Keisha Lambs Bottoms, might be on the same page with you, Dr. Waz. It seems like she does not, mind speaking out against the governor and for the good of the people. Listen to what she's saying in rebuttal to the governor.
Have to live to be able to fight another day. And so when we're talking about this economic pull and getting to recovery, if we're not alive on the other side of it, then there won't be a recovery to be had. And again, let's look at the data. We see our numbers are continuing to tick up in this state. We see that our deaths are rising. We have some of the highest asthma rates in the country right here in Atlanta.
She definitely did not mince her words, and she was right on point. Maryam Muhammad, what do you think about Mayor Bottoms' rebuttal?
I think I come from the same place that she's coming from as a mother and as a healthcare provider. I'm concerned about the decision that Governor Kemp has made to immaturely open up non-essential businesses at that to start off with. I think when you make a decision like that, you have to consider our healthcare workers and their families and the sacrifices that we're making to actually do our job. And I feel like this decision is just going to push us back 2 steps after all of the sacrifices and the work that we've been doing to try to contain it and try to control it. And I agree with Keisha when she says, don't listen to politics, don't listen to her, don't listen to Kemp. Listen to what your healthcare providers are telling you, because we are the ones on the front lines who see people dying and sacrificing.
And it's crazy that even somebody like Donald Trump could agree that this is not the right time. Take a listen to what Trump had to say in response to our Governor Kemp.
Brian Kemp, that I disagree strongly with his decision to open certain facilities which are in violation of the phase 1 guidelines for the incredible people of Georgia. They're incredible people. I love those people. They're great.
We're so great. We're so great, Trump. So if this guy can clearly see that there is a huge issue at hand, Heather, this is definitely a question for you. What is the probability, especially given Miriam's statement, that we'll have a pandemic part 2 if things open entirely too soon?
I think that's a great question. And I think with looking at the research, we also need to look at what has happened in the past. We saw this in our country 100 years ago during the Spanish flu, where we saw a resurgence in cases, and that's what caused an insane amount of deaths. So I think what Governor Kemp should be doing is, I'm grateful and happy that he actually spoke with a top epidemiologist and got kind of some research and things like that. But the message, if the state of Georgia is going to be reopened, I think the message needs to be clear and concise, and so that we're not all confused. I mean, also having people at that roundtable discussion who are working on the front lines. I understand we have CEOs of hospitals and CEOs of all different types of businesses, but we need to be listening to our healthcare workers. Nurses and doctors like myself and Miriam and Dr. Waz are seeing what's happening with our own eyes and seeing what's happening to patients and family members that can't even say their last goodbyes to their loved ones. Those conversations need to be held in the same room with us.
Miriam Muhammad, as we are coming out of this conference and as a lot of people are sitting and tuned in, afraid out of their minds, what do you think the best thing that Georgians can do right now to just go ahead and keep safe?
I think the best thing to do is to follow the social distancing guidelines, like we have been doing. Continue what you've already been doing. Don't. If you have been sheltering in place, I know there's some people who haven't been doing that, but I hope that they come around and see that things will get worse if you don't. I just hope people will continue to do that or start doing that.
Yes, I agree. I would like to open this up to anybody who would like to answer. So if things continue at the pace that they're in, and we do understand that, yes, the curve has flattened, and thank God, due to measures like staying home, we have been able to see the numbers improve, which is, of course, why we believe Governor Kemp may have decided to go ahead and reopen these non-essentials. But if we continue to stay sheltered, ignoring Governor Kemp, how long do you think it will be before we will be able to reopen and return back to normal life?
Well, I just want to say a couple of things. Go back, and I'm going to ask your point. So what we do in the hospital, I'm sure Heather as well as Miriam can kind of attest to this, is that we treat everybody as if they have COVID-19, all right? And what we do, we put on protective gear. We wear a mask, goggles, gloves. We even wear an extra covering over our scrubs or we change our scrubs. So fortunate enough, in our emergency department, we haven't had any nurses to convert to COVID-19 because we're taking these necessary precautions. We can't, we put things on and then we take them off. So if you can do that in the community, if you can go to a restaurant or you can have a business where you can do those things, which again, even as a healthcare professional, we have a hard time doing. Let's understand what the hospital professional workers do in their spread, and what the community can do to do it if we really talking about coming back together at this point. And speaking of open up open up the economy, and when can we do it? The wild card, it's not about people who have COVID-19 or the people who are showing symptoms. The wild card is people who are asymptomatic.
Mm-hmm.
The problem is that you got people walking around who don't know they have it.
Mm-hmm.
Unlike the flu or unlike other things, this is something like we've never seen before. So you telling me you have asymptomatic people and you don't have a good surveillance in order to test these people? So until we have proper surveillance testing that's worked and really sensitive, and or we have a vaccine, we need to talk about a new normal. Because we got to have those things in synergistic. Again, I do agree with the governor that things are getting better. I totally agree on that part. From my perspective, we've seen things improve considerably. However, we have people who are asymptomatic carriers. That's a problem. That's a problem. So again, surveillance, vaccine, it takes 12 to 18 months. We got to make those two together. I think in order to feel comfortable opening up.
Ooh, Dr. Wise, you said 12 to 18 months?
For a vaccine.
What? With everything you said, all I can say is, yeah, you're right. Because, the only thing in my head, because my daycare, they sent an email asking who's returning on Monday. Yeah. And I look at my kids, as much as I want to throw them out the door, I can't take that. Because like you said, what if this little kid is, okay, you have precautions, like Governor Kemp said, with the temperature check and the asthmatic check. But if you have none of the above, and then I do show symptoms, so you've given me COVID and now my symptoms are extreme, how dare you? But you didn't know. So that's the most scariest part to me. So I'm going to have to agree, Dr. Waz. I probably won't be going out until 2022. And even then, I don't want to have a predicted date until there is a plan of action, like a vaccination to the community, because other than that, what are we talking about? It doesn't make any sense. So I agree. Does anyone have anything that they'd like to say on that?
I think Dr. Waz brought up a great point about being able to isolate and whatnot. I think also too, as a healthcare standpoint, and as all of us as healthcare professionals, one of our main concerns, regardless of what patient, it's always safety and always to do no harm. So it's gonna be hard, and as difficult as it is, we don't really know when our communities are gonna be opening back up. There's no set date. We're fighting an invisible war, like Dr. Waz says. There's people walking around with no symptoms, and it's kind of hard to track and trace when people are having these symptoms, or when people aren't showing these symptoms like a regular virus, like another virus like the flu or whatnot. You could be able to track those symptoms. So I think for us to be able to open up together as united, we need to be able to, one, always be safe, and two, be able to test, isolate, and trace those cases. And until we're able to do that, we need to do our best to stay at home, wash our hands, and limit our exposure.
Absolutely. Absolutely. But now that Governor Kemp has decided to go ahead and open up those doors, there might be a whole nother influx due to a respread, so that may not be the best idea. And that is concerning me as well.
Right. And then also requiring these non-essential business like barbershops and nail salons to always wear masks and to provide their customers and employees with masks.
It's not going to happen.
Of course. I mean, hospitals can't even get masks. We can't even get enough for our healthcare workers. Now you're adding even more strain to the
production industry.
Yes, the production industry, to try to get masks out to these non-essential businesses when we don't even have a lot of them. We're losing. We have to reuse our masks. When I can tell you last year that wasn't the case. The amount of supplies that we go through in a hospital is ridiculous. I can tell you on one day, myself, one shift, if I'm doing surgeries all day, C-sections, I'm going through at least 15 surgical masks, at least. It's, and now I have to use one for a week.
Yeah.
for a whole week or a whole day.
That's ridiculous.
You
That's
know,
Yeah.
ridiculous.
So
terrible.
Well, God willing, everything gets better. Heather, thank you for your time. Dr. Waz, thank you for your time. Miriam, thank you for your time.
thank you. You're welcome.
Atlanta, I hope you guys are staying informed, surrounding cities, all of Georgia, and even you're based out of where right now, Heather?
I'm based out of Minneapolis right now.
You're in Minneapolis, and even people in Minneapolis, these different states, you guys have to understand that even though our governor is making the example of himself, this is not the only place that this is going to happen. The reopening is up to whichever state and how they feel. You know, our president has not used his stern fist to put a stop on the spreading of COVID. He is very loose with it. So you can only imagine that this is not the only conversation to be had about the situation. So God willing, we stay informed and we do what's best for ourselves.